I'm called Zone Zero. I work with a feminist organization called Women for a Change. We are an advocacy organization working with adolescents around sexual and reproductive health and rights. At the moment, we've been carrying out sensitization campaigns online, encouraging young people and adolescents on how to keep safe. And keeping up with the adolescents and young people in times of COVID is really challenging, as most lack access to, as I said before, technology information. But fact, we have developed a one teach three model of virtual participation through the creation of the adolescents-led program, which is called Mifali, which is now online. They do have a Twitter handle as well as also a Facebook page, through which we continue to engage with a few adolescents who have smartphones, through the WhatsApp group that we've also created. And SMS also, we've used SMS as a measure to reach out to more adolescents within our network, continuing the conversation around how to stay safe, also how to keep in terms of managing menstrual hygiene. And because now most communities, they kind of, in as much as there's isolation, they kind of like, you know, a lot in a particular community or in a particular household. So how do you take care of your body? How do you manage your period in a time like this where there is water crisis? All of that has been conversation over the past 4 months that we've had with these adolescents. So my message to global policymakers and funders is SRHRA is as important as ending COVID-19. And during this pandemic period, people's SRHRO are in danger and at risk of gross violation. A lot of families are forced to stay at home. And this has resulted to cases of intimate partners violence. This has resulted also to exploitation and sexual abuse on kids and girls who often in my context are very vulnerable and are those exposed to many dangers. So I see a very close connection, and in a response strategy like this, there is need to think comprehensively and also think broader on how to actually address the public health pandemic, but at the same time not forgetting other issues that as a result of this pandemic, and among which first is the case of gender-based violence, which has increased a lot in most of our communities. And I also, it will be important to also understand that we live in a community that before COVID, we had war, and now there is COVID. And again, there is flood. So we are facing a lot of issues that, in my view, any recovery plan must be as holistic as possible. Otherwise, we'll be taking a step forward, but 15 steps backward.